Good morning, ladies and gentlemen. I would like to say thank you for coming to my presentation. Let me introduce myself. I am Elvan Wiyarta from Universitas Indonesia. In this opportunity, I would like to present a very unique case report titled Balloon Atrial Septostomy on Newborn with Double Outlet Right Ventricle and Restrictive Foramen Ovale. First, as an introduction, I will explain to you about double outlet right ventricle or DORV. DORV is a cyanotic heart defect in which both aortic and pulmonary trunk are connected to the right ventricle. Moreover, DORV is often accompanied by other heart malformation such as ventricular septal defect, pulmonary stenosis, coarctation, and arterial septal defect. As you can see here in the case description, in this case, we have cyanotic female newborn with decreased activity right after birth. The neonate was referred to the pediatric department of Dr. Cipto Mangunkusumo Hospital with oxygen saturation of 50%. Then, the patient was intubated and hospitalized for further observation. This arrow represents the history of observation in patient starting from hospital admission to discharge. During observation, the patient underwent echocardiography which showed some findings such as DORV, restrictive ASD, mitral stenosis, small left ventricle, small muscular apical VSD, and a PDA. Let me take you a closer look. In this picture, we can see a small left ventricle due to mitral atresia. Meanwhile, here is a picture of the restrictive foramen ovale that resembles ASD. So what actually happened to this patient's circulatory system? As previously explained, this patient has DORV, which caused mixed blood from the right ventricle to be distributed to the lungs and systemic circulation. Usually, DORV is treated surgically according to its type. But as the echocardiography shows, this patient has a quite complex heart condition, such as restrictive ASD, VSD, and especially mitral atresia. The presence of mitral atresia in this patient makes this case very interesting, because it will cause right to left shunt through the restrictive foramen ovale. This will lead to blood mixing problem that will cause low oxygen saturation in the right atrium, which then flow to the lungs and systemic circulation via right ventricle. Besides that, unfortunately, the shunt doesn't provide sufficient amount of blood due to the restriction of foramen ovale. This causes the right ventricle doesn't have enough blood to circulate to the lungs and throughout the body. This will cause low cardiac output. So basically, this patient has two major problems. That is the low oxygen saturation and low cardiac output, all of which are due to the restrictive foramen ovale. So what we have to do is enlarge the foramen ovale with a procedure called balloon atrial septostomy or BAS. As you can see here in the method section, a catheter is used in the BAS procedure and directed toward the left atrium guided echocardiography. The balloon was then inflated and the catheter was pulled, creating non-restrictive ASD, which allowed blood mixing and increasing the oxygen saturation of the systemic circulation. This result can be seen in these before and after BAS echocardiography picture. We can see here there is an increased diameter of the foramen ovale from 0.295 cm to 0.4 cm. The increase of this shunt will lead to more oxygenated blood being mixed and increase the volume of blood entering the right ventricle. BAS will increase the blood oxygen saturation and also the cardiac output, as can be seen in this patient who show an increased blood oxygen saturation from 40% before BAS to 85% after BAS. The result of this procedure is very good. On the 4th day after procedure, the patient was allowed to be outpatient and waiting to undergo gland and fountain surgery for definitive treatment. To conclude, this case shows that the BAS procedure has benefit in terms of clinical medicine by showing that this procedure can be considered and could be one of the palliative treatment of patients with DORV, especially if accompanied by a restrictive foramen ovale. That's all, ladies and gentlemen. Thank you for your attention.